So this week's condition we're going to discuss is Osgood-Schlatter disease. Now, it's a very common injury in youth or adolescents that are very active in sports. Now, the age ranges tend to be somewhere in like the 10 to 15 years old. About 10% of adolescents get this condition, and what they typically feel is just pain just south of the kneecap. So what Osgood-Schlatter disease is, it's just an overuse injury of just repetitive stress and tension being put on the location where the patellar tendon attaches on the bottom of the leg. And what it does is when you just overuse the quads or you're doing a lot of activity, that pulling of that muscle or that tendon will just kind of irritate the tissue, and it'll kind of create this pain and discomfort. So what we typically see in the office and how we can help this condition is we have to determine what is the biomechanical imbalances in the body. What is creating this condition? Because a lot of times we see Osgood-Schlatter disease when the patient has very hyperactive quad muscles, weak adductors and abductors, as well as maybe glutes and hamstrings. We just kind of have like a muscular imbalance that's creating a little extra stress in certain areas. Now, our goal in the office is to, one, figure out what's going on. What muscle groups are kind of overuse or overactive. And then what we tend to do is treat it. So we're going to treat the pelvis, we're going to treat the hips, we're going to treat the knees, we're going to do some soft tissue work around the area and kind of rebalance all that musculature. Now, it's very important. Adequate rest is useful for this condition because we have to get the inflammation down, but we also have to fix, the cause. We got to figure out what is the root cause of this condition and fix it. Once we kind of get all that solved, kind of get you back into the gym doing exercises and stretches, then we kind of have to just load the tissue. We have to start with some running, some jogging, some cutting. We want to make sure that the body can sustain those activities without the pain coming back. Because this is one of those conditions that doesn't necessarily need trauma to occur. It just comes on slowly over time because the stress on the tendon just progressively gets worse and worse. So we have to make sure that we're providing proper load management when we get you back into sport so this condition doesn't come back. So if your child, someone's child that might be dealing with some kind of Osgood-Schlatter disease type of pain, any kind of pain right below the kneecap, we'd be happy to take a look. We're a very good triage physician. We do a really good job of evaluating and determining if that's truly it. And if it is, and it's in our wheelhouse, we'll take care of it. So we'll be happy to help. Give us a call at the office at 513-463-3011, and we will see you soon. Thanks. Have a good day.